The O-arm is an intraoperative cone beam CT, or computed tomography system. What it does is it will take multiple radiographic images and then piece them together to create a three-dimensional image of the bone structure. One unique thing about this is it's an intraoperative imaging system. Instead of taking the patient to a CT and then moving the patient into the OR and then performing surgery that way, you're in the OR, you're taking one CT, and then you're basically able to do the surgery with all the instruments that you want. It understands where the CT image is, it understands where the structure that you're imaging is, and then it basically allows all of your instrumentation to follow along in those anatomical structures. And so you can see on a screen where the tip of any type of instrument is and the trajectory of any type of instrument.
We are the first ones to have access to this kind of technology in the vet medicine. So it's a large conversation to have in how we can use this in animals, what is important, and what is the role that we're playing on this.
So you see the blue line there, the blue square, that's the trajectory?
I mean, it's a big effort. One, we have to have people to run this system and understand what this system does. So that's where Anders comes into play. He's basically the expert on understanding how to run the system, how to increase the image quality of the system. He works with the surgeons to allow them to kind of focus on their job of understanding, what are we going to do in this procedure? How are we going to use this system?
So as a university, having these technologies has been great because we are basically developing those procedures for other surgeons. Before they have to do it like with an open approach, take a longer time. Now we are having clinicians and surgeons showing the technology, how is the accuracy improving, and they are so more confident to do it. This also helps the confidence of the owners of the patients to have these procedures performed here at CSU.
So veterinary surgery in general is typically 10 years to 20 years, sometimes behind the human space. Sometimes companies won't sell these technologies to veterinarians because they're indicated for humans only. The way that we were able to make this happen is through multiple funding sources. One, through the Department of Clinical Sciences, my research laboratory, the Preclinical Surgical Research Laboratory, the Translational Medicine Institute, as well as the VHS and the OVPR's office at CSU. We have been able to acquire this technology and basically be utilizing this technology in similar ways that they do in human space, but actually beyond that. We have been able to validate these systems for all different areas of the body that maybe aren't indicated in the human space. It's actually been great to partner with Medtronic on some of that because they can give us different ideas of, hey, we have this instrument, maybe you can use it for that. Also, we've been able to come to them with different ideas and say, we're using this technology for this. They may even think about, there's an indication in humans that we can use this technology as well. What's really exciting about this is that we can use this technology both in research as well as clinical patients. And a lot of what we will do in clinical patients will come about from the research that we perform, whether that's validating what the system can do, whether that's being able to evaluate human technologies. And so there's a lot of potential with this technology that will hopefully make huge impact on both animal health and human health in the future.